As a medical doctor working with people who have kidney disease and also a researcher in the Regenerative Medicine Institute at NUI Galway, I'm often struck about how often patients and their families ask me about new research developments and new breakthroughs that may impact their lives or the lives of their loved ones. In particular, patients are often interested in hearing about new developments in stem cell therapies, regenerative medicine, tissue engineering, new diagnostic tests, and new drugs and medications that may be coming along that would help their particular disease. Kidney disease is an area that perhaps people have a poor understanding of, maybe compared to heart disease and diabetes and other common diseases in the population. However, over the past 2 or 3 decades, there's been a worldwide increase in kidney diseases of varying degrees of severity, and this has affected us in Ireland very much in a similar way to other westernized countries. The most recent data from our National Renal Office would suggest that as many as 7% of the Irish population have some level of reduced kidney function. This can have important health implications. In particular, it increases the risk for heart disease, high blood pressure, and early mortality from cardiovascular events. Also, a proportion of people with what we now refer to as chronic kidney disease will go on to lose kidney function over time and may require renal replacement therapy such as dialysis or a kidney transplant. And it's this population of patients that I often find myself talking to about research developments in the clinic. So the causes of kidney disease are very much linked with trends in our society as it's developed in recent decades. And as a result of lost productivity and costs for healthcare, particularly expensive healthcare like dialysis and transplantation, the financial burden on our country is quite considerable from kidney disease, not to mention the personal cost for people and their families. So our Regenerative Medicine Institute is focused on understanding the science behind different types of stem cells and also applying this to different disease types that affect our population. Kidney disease is one category that may in the future benefit from stem cell therapy. This could come about in a personalized approach where an individual person's stem cells are developed in a laboratory and then used, for instance, to engineer a new organ or as a therapy for modifying a disease like diabetes. Another way that stem cell therapy may help patients in the future is the use of stem cells from healthy donors to benefit people with diseases such as inflammatory or immune-mediated kidney disease. In this case, the stem cells may reprogram the body's abnormal response to improve or even prevent a disease. Another example that's relevant to kidney disease is the use of stem cells to help improve outcomes from organ transplants. And there has now been work in human subjects showing that stem cell infusions at the time of transplantation is a viable alternative to some of the immune-suppressing drugs that are currently used. I think kidney disease is a good example of an area where communication of scientific knowledge and research and progress could have a very beneficial effect in the short term as well as in the long term. In addition, I think patients deserve to understand their disease as much as they can and also have a good working knowledge of how scientific research is working towards beneficial cures in the future. It's well known that early diagnosis of kidney disease is one of the ways that we can intervene to prevent its complications and for some people prevent the progression towards advanced renal failure. It's also a time where a new treatment may be more effective than trying to intervene when a disease has progressed to a very advanced stage. So part of this process is informing the public so that people are aware of the relevance of kidney disease, how it's diagnosed, and how they can go about protecting themselves or their loved ones from the more severe complications of kidney disease in the future.